Okay, let's talk about kidney stone prevention. So first of all, there's pretty much no diet or medication that's going to get rid of stones that are already there. There's some rare exceptions, but for the most part, if there's a stone that's there in the kidney or in the ureter, there's no diet or medicine that's going to get rid of that stone. That's a separate talk. This is for people who've had stones in the past and want to make sure that they never get one again, or people who are just being proactive about their health and want to know how they can avoid the horrible situation they've heard about with kidney stones. So let's start with what is a kidney stone. Basically, the urine is water with different salts dissolved into it. And if it gets to be too concentrated, some of those salts can fall out of the solution and basically come together like sand and form little stones. Sort of an oversimplification, but that's a good way to think about it. So the number one way by far to prevent kidney stones in all patients is hydration. Basically, if you add more water to your lemonade, it becomes more dilute and it's less likely to precipitate. The salts are less likely to precipitate out of the solution and form stones. And if you're somebody who has no history of heart disease or anything like that, you can walk around with the water bottle and drink up to 3 liters of water a day. And it actually doesn't have to be water. It can be almost any drink. It's just a matter of flushing fluid through the system. The exceptions would be a cola, like a Coca-Cola, a dark cola, that can increase the risk of kidney stones. Obviously, if you're diabetic, things with sugar are unhealthy and they can also increase the risk of kidney stones. But generally speaking, it can be coffee, tea, beer, almost anything, as long as you're getting a lot of fluid into the system. Now, people with history of kidney stones, they often will follow this recommendation for a year or two and then sort of forget about it, and then a few years later, they're back in the ER with another stone. So it really has to be a lifelong thing of really making sure that you're hydrated. And we see kidney stones more often in the summer when people are out and about and it's hot outside, and in the south. Obviously, because year-long they have higher heat and dehydration. So that's, if you take away one thing from this talk, that's it. Hydration helps get rid of kidney stones or prevent kidney stones from forming. Number 2 on the list is salt intake or sodium. And it's usually not people adding salt to their foods. It's usually eating processed foods or foods at restaurants. Anything that comes in a can generally has a lot of sodium. And they don't often say it on the front. You have to turn it around and look and see the sodium content in there. Now, it's not that the sodium is actually part of the kidney stones. There's no such thing as a sodium kidney stone. But the way that your kidneys get rid of sodium and put them out of the blood and into the urine, they basically bring calcium with the sodium together. There's a transporter that does that essentially. So a high sodium diet tends to lead to high calcium in the urine. So by decreasing sodium intake, you decrease the calcium concentration in the urine. Interestingly, a low calcium diet is not recommended. That does not help to lower the risk of kidney stones. It's somewhat complicated, the mechanism. We don't really have to go into it, but it's pretty much recommended that people, even with calcium stones, just consume a normal amount of calcium per day and not try to decrease their calcium intake. The third recommendation is the decreasing intake of animal proteins. Now that's any type of animal, including fish, chicken, turkey, red meat, white meat. Any animal protein, when your body processes it and it ends up in the urine, that can increase the acidity of the urine. So you don't have to become a vegan, but the typical American diet where you have a big piece of meat with every meal certainly increases your risk of kidney stones. Now, somebody who has a lot of fruits and vegetables in their diet, that actually decreases the risk of kidney stones. So somebody who's eating lots of fruits and vegetables, foods that are not processed, that don't have a lot of sodium in them, and they're constantly hydrating, their risk of kidney stones is way down. Now, these recommendations that I've given you are sort of the general recommendations. People who are high-risk stone formers sometimes need more specific recommendations on their specific situation. Now, in order to get those specific recommendations, you need more testing, obviously. So number 1 is if you can get the stone itself, whether it's removed surgically or you pass it, if you can get that stone to your urologist, that can be sent to the lab and we can tell exactly what type of stone it is. Now, usually they're garden variety calcium stones. but sometimes it's a specific stone type, and that can help us to figure out what exactly is causing your stone formation. The other thing that is done is blood work and a 24-hour urine collection, where you collect your urine for 24 hours straight in a given day without changing your diet or activities that day, just a regular day. Bring in that 24-hour jug to be sent to the lab, and then we can do some analysis on all of that. Basically, that gives us a picture: the 24-hour urine, the blood work, and the stone analysis. We can put all of that together and give you some more specific recommendations. Now, most of the time, the recommendations actually end up being the same. You need to drink more water, less salt, less animal protein, more fruits, but sometimes we can tell you it's actually this other thing and you should maybe start taking this medication. Or in your case, you're drinking enough water, that's not the problem. You don't have a high salt diet from what we can tell, but in your case, it's really the animal protein that's likely contributing. And then you can focus on that. But for most people, it's not necessary to do all of that testing. As you can imagine, it's somewhat difficult to collect all of your urine for 24 hours straight in a jug. For most people, just trying to follow the regular stone prevention guidelines of number 1, 2, and 3 is really hydration, next decreasing sodium intake, and next decreasing intake of animal proteins. That will likely decrease your chances significantly of ever forming kidney stones. Thanks for watching. Please like, comment, and subscribe.